good afternoon, and thank you for the County Executive's weekly media briefing and public health update. Thank you, Mr. County Executive, for being here. And our guest today is Mr. Becca Urguesa, who's Senior Administrator for School Health with the Department of Health and Human Services. And Dr. Earl Stoddard, our Assistant Chief Administrative Officer, is also joining us. Thank you for being here, Mr. County Executive. The floor is yours.
Good afternoon, everybody, and welcome back to everybody who's back here from last week. The new school year is here, and I've got a few things I want to share with Montgomery County families. First, the good news. We've opened 3 brand new school buildings, Joanne Lullick Elementary School at Broadacres, Burtonsville Elementary School, and Poolsville High School. We held a ribbon cutting for all 3 on Friday, the 21st. And these are exactly the kinds of investments that we should be making in our kids and our community. I was pleased to be joined by Dr. Taylor and Councilmember Mink at the Burtonsville Elementary School. This was a project that was originally planned as a renovation of the former Burtonsville Elementary. However, the cost of the renovation was going to be very high and it was going to be disruptive, as many of these renovations are. One afternoon, I happened to be in Burtonsville, and I was meeting with people from the district delegation up there. And as we were walking around, one of the members asked me if the county hadn't received the school site as a part of a big redevelopment plan. There was a big development that went in on the other side of 198, and he had a memory that somehow the county got a school site out of it. So when I go back to my office, I actually checked to see whether or not we did get a school site, and lo and behold, we did get a school site. So I called the school system and I said, why are you rebuilding the old Burtonsville Elementary School? We got a new site on the other side of the street. And they checked it and there's like, yes, we do have a new site. And it turned out to be a much better site. Let them do things that have been very hard to do at Burtonsville. So I was very excited about that. So we have this beautiful new school now. Many kids can walk to the school, which is pretty much impossible in the old site. So this is truly a neighborhood school. And the former school is going to be renovated into a pre-K facility and as a community center. So there'll be community meeting rooms there. And we're getting extra playing fields that'll be available for community use. So we're making good use of the old school. And the new school is really nice. And the kids seem very excited to be there. Another good school news, 26-27 school year started yesterday with new rules for cell phones, conveniently called no cell bell to bell. You've heard me talk about how distracting cell phones are in a classroom on the media briefing many times. I, over the years, have been in classrooms and watched students just sitting in the classroom playing on their phones while the teacher's trying to teach. That does not work very well. I was amazed the school system didn't shut this down earlier. It's a long overdue change, but it absolutely improves the learning environment and allows our kids to focus more on their schoolwork. Since MCPS recently reported its enormous maintenance backlog, I've been stopped by many people who want to know how we got in this mess and how could you possibly end up with a $3 billion bill for what is simply needed repairs to aged buildings. And the answer to this is simple, but it's going to be hard to hear. For years, prior MCPS leaders didn't ask for all the money they needed because they thought the level of funding wouldn't be approved. That would be true because year after year, multiple councils clung to an unwillingness to raise the bond capacity, not even enough to cover inflation, let alone growing needs. And so, what happened was the school system knew that the council had set bonding limits that would force them to make a choice. Either they build capacity for all the new students we were getting, and it was tens of thousands of students at one point total, or we fix the schools and then we overcrowd our classrooms. And the schools knew they weren't going to ask because they weren't going to get in a fight with the council, particularly you don't get in a fight when you know you're going to lose. So they didn't push the council. The council wasn't overly curious. This is many councils, not just one council. And over the years, expansion won, maintenance lost, and needs piled up. And they made that decision to focus on expanding capacity in order to meet the growing student population. Now the maintenance backlog has grown to about $3 billion. I attempted this year to raise our limits substantially, and the council again refused to raise the limit substantially. They did make a small adjustment in the limit, but it's absolutely inadequate. It barely keeps up with inflation, if it even does that. So this is something that we're going to have a reckoning for, and I think that people have to understand the school system made it pretty clear that in some of these schools, when the air conditioners fail, school will be closed. We don't have holding schools in places to put these kids, so it's going to create real problems as this problem piles up. We've got a lot to think about. The good news with declining enrollment, expansion doesn't have to compete with fixing things, but it's a serious problem. And just so you know, we're not the only jurisdiction in this predicament. This is the assessment of all public schools in Maryland as of August last year. As you can see, that 46% of the schools are functionally unreliable. 34% need repairs, and about then 20% are actually in good or satisfactory. Or I should say like new, good, or satisfactory. That's a pretty wide range of things. The Maryland Interagency Commission on School Construction has a goal for all schools to be at least satisfactory. To achieve this, 1,090 school facilities would require repair, renovation, or replacement. The state doesn't have that kind of money either. The IAC has a project underway to estimate the cost of completing that goal and bringing schools up to a condition that level of support for educational sufficiency and physical sustainability. The commission will be studying missing facilities like science labs, pre-K classrooms, improving facility conditions, and improving the energy performance of schools. A similar study conducted 20 years ago determined $4 billion in work was needed. That would represent about $12 billion in today's economy. So that should give you an idea of what kind of backlog we're facing, not just in the county, but statewide. I'm going to continue to push for new funding methods, as I have for several years, more than several years now. It's important more than ever for Montgomery County to have greater autonomy about how we generate revenue, so that we do not put all of this on the backs of homeowners to increase property taxes on residents. We need the county council to ask our state legislature to allow differential taxing, an authority our municipalities already have. Our current tax structure means that we have the lowest commercial tax rates in the region without any benefit. And I said this before, we won the race to the bottom. Congratulations. We can boast the lowest commercial property taxes, except for DC, has the lowest residential taxes. Actually, the highest commercial taxes. We can boast the lowest commercial property taxes and the lowest residential taxes in the region, except for DC. And it has nothing to do with to help us compete with jurisdictions who raise more in commercial taxes and build the infrastructure they need to attract growth. Something we can't do within our current tax structure. So basically our current tax structure, which I'm showing up here on the screen, it gives you an idea where we sit, Montgomery County, compared to other jurisdictions. We've got, we're at $1.08 when you do the adjustment for the loss of the ITOC. Frederick County is at $1.11. Fairfax County is at $1.16. Their commercial taxes started at $1.28. Howard County is $1.33. Their commercial taxes are $1.33. Prince George's County is $1.37, and commercial taxes are also $1.37. Western Virginia residents are at $1,224, but commercial properties at $1,480. That's not 1,000, that's 1.22. The residents are 1.22, which is about 14 cents higher than us, and commercial is 1.49, which is about 41 cents higher than us. And Washington, D.C. takes the championship prize. The residents only pay 85 cents. Commercial property pays up to $1.89 in the District of Columbia. So just so you know, when I talk about raising commercial property taxes, we would be below where they are in D.C. and we would be below where they are in Virginia, our two major competitors for jobs. So keep that in mind as the year unfolds. Student vaccinations continue, and the county and the state of Maryland's vaccination guidance stays the same. No shock, we're not listening to Robert F. Kennedy Jr. or Donald Trump because they frankly do not know what they're talking about. We know the recent news is going to cause confusion for some people, but as you know, we pointed out, vaccine guidance in Montgomery County in Maryland has not changed. Vaccinations are essential. A school supply is pencils and paper. Without vaccines for things like flu or measles, public schools would not be able to take your children the entire year. That's one reason the county continues to offer free vaccination clinics for students through Friday, September 25th. Staying current on immunizations protects individual students, helps prevent the spread of disease in our schools, and strengthen the health of our entire community. And I encourage parents and guardians to review their children's immunization records now and make an appointment as soon as possible if any vaccines are needed. I also want families to know that earlier this year, federal health leaders changed the childhood vaccine schedule outside the usual scientific review process. Major groups like American Academy of Pediatrics are sticking with the original recommendations instead. My advice, follow the advice of your pediatrician and the Maryland school requirements, which have not changed. Pretend like Robert F. Kennedy is just noise in the background. We're just simply not going to go along with what he wants to do. And it's really sad that the president once again has decided to go along with this. I want to welcome my guest this week, who's Becca Urgesa. He's a senior administrator for school health in the Department of Health and Human Services. So far this year, we're seeing fewer children needing vaccinations to meet school requirements, which is a good thing. That count won't be official until next month. So welcome.
Thank you very much. I am the Senior Administrator for School Health Services. I would like to give some information about the back-to-school immunization efforts that we are making currently. The most important thing for parents to know right now is they really need to check the immunization status of their child. The process we have right now is our school health room staff, school health room nurses, and school health room technicians, they review the student medical record and they review the immunization status also. If they found out that the child is missing immunization documentation, there is an official letter that they send it to the parents that clearly and specifically mentions what immunization is missing, so the parent will have time to review and take action to get their child vaccinated. Also, are immunization clinics still available now that the school has started? Yes. So the free back-to-school immunization clinics have been open since July. They are open in August also, and they're going to be open for September. So parents will have the opportunity to take their child to one of those clinics. So what should parents do if their child is missing the required vaccine? So if once they receive the letter that was sent from the school, they get to know what vaccination their child is missing. So the next thing is, okay, what's the next step once they know what's missing? So they have two options. They can go to one of the free clinics that we've been offering since July. They can go to one of that location. That's the first option. The second option is if they have a doctor, they can also take their child to their own doctor to get those missing vaccinations administered. And what if a family does not have a healthcare provider or is having difficulty getting an appointment? This is also the free clinics that we have is also a good opportunity for our staff to inform the parent. When they come in at these clinics, they will get the vaccination regardless of insurance status. However, we also talk to them, okay, do you need do you have health insurance? If the parent says yes, then fine. If the parent says they would like to have insurance and because they don't have, then we have already ready-made informational flyers that we give it to the parent so they know where to go in the county to get that insurance and also other county resources if they need. We have in Germantown, Mid-County, and Silver Spring locations that we usually refer them to get those insurance applications processed. Can a student attend the school if they are missing an immunization? So we follow the state of Maryland regulation. If they are missing immunization, they still come to school. However, they have that 20 calendar days to be compliant. Within that 20 days, we ask the parent to take the child to the immunization clinics or to their own doctor to get the vaccine, the missing vaccines administered to the student. So basically, that was the main reason we have those clinics. So we have, enough time for the parent to get the student be compliant with the 20 days requirement. Our goal, as always, our goal in MCPS's goal is to prevent student exclusion because of being non-compliant with immunization. We work in partnership with MCPS and other local healthcare providers to make sure the students are compliant with the required vaccinations. So, like I mentioned, we try everything. We inform the parent. We give them extra information. We share accesses for them to get the vaccinations so that they will have, every opportunity to get their child immunized and provide the required documentation before the deadline. So the reason why we are still doing in September is just to help them be compliant with required vaccinations. And like I mentioned earlier, our school nurses and school health room technicians across 211 schools in MCPS, they review the student record and notify the parents depending on what immunizations are missing. If they found out some immunizations are missing, they reach out to the parent. It's not just sending the letter, they also make phone call to remind the parent to take advantage of the September free back to school clinics and to take advantage of the other county resources so that their child will be compliant. So my message, our message to parents who are watching this is, we just want them to review the letter that they receive from the parent, check their child's immunization status, and please don't wait. They need to contact their healthcare provider or take advantage of one of the clinics that we have in August and then also in September. And then also very important, it's not just getting their child vaccinated. We also need that record from the parent to turn it into the health room. That way we can check them off being compliant with the required vaccine. So our goal as always is to keep students healthy and then stay in a school. So that's our message to the parents. Thank you.
Thank you for sharing that today.
Thank you. Thank you very much, Mr. Urgesa. Members of the media, if you have any questions for our guest this afternoon, please raise your hands. Alexandria Barnes, Montgomery Community Media. Good afternoon, Alexandria.
Good afternoon.
Go ahead. You have a question? Your hand's up.
Sorry, I went on mute.
Okay.
For parents who may be on the fence about vaccinating their child right now, especially with the deaths that have happened just there north of us in Pennsylvania, what would you say directly to those parents who are on the fence?
I'd say get off the fence. I mean,
Okay.
look, these vaccinations have a very long history. Deaths had disappeared in the United States because of the vaccinations. And so what we're seeing is a return of illness and a return of death. All this is absolutely unnecessary. There's zero evidence for what Trump asserts and Kennedy believes. It's not supported by anything. And what it's going to do is going to make more people sick. So I'm not sure if they're trying to reduce population so they can reduce the cost of government. It's kind of a strange way to do it. But it is absolutely not in the best interest of the American people, not in the interest of your kid.
Thank you for that.
Mr. Guest,
And
do you
then,
want to add anything to that?
No, you said it right. Especially also, time to time we may have some outbreaks, and the best way, evidence-based way to prevent outbreaks is also being immunized. When the more students being immunized, it's a lesser the outbreak would get out of control. So especially with the measles, happening, having the child immunized is it's really a priority.
Yeah, I would just add on there that measles being the most highly infectious disease that respiratory disease, spread disease we're talking about here. This is why our schools want 96, 97% vaccine. It helps to protect not only, it helps protect any older adults whose immunity may have waned, maybe did not have the shot. So it's really important, especially for measles, but for all of those school required vaccinations. The reason they're required is to provide that immunity. There are a very small number of individuals whose doctors will say they can't get that vaccine for health related reasons. And that really should be the only time someone doesn't get the shot. They really need those vaccinations before going into early childhood education settings, child care settings, and school settings.
Thank you, Mr. O'Donnell.
I'm going to give a little more color because I think, I've obviously.
I was just saying, Earl, Alexandra, your mic is on if you can mute because some sound's coming in. Sorry, Dr. Stoddard, go ahead.
Yeah, I think what we're seeing across the country is we as a society have had great success in defeating some really terrible infectious diseases through vaccination and through improvements in medicine. And I think we're getting into a period of time where people don't have the memory of what these diseases look like when they were running rampant across the country. And, we have a lot of parents who don't understand the numbers associated with something like measles, where unvaccinated people end up 1 in 5 in the hospital. Okay, well, we only have a 20% chance of ending up in the hospital, but the other complications include pneumonia, encephalitis, and encephalitis can lead to developmental disabilities. It can lead to permanent deafness. We haven't seen those widespread outcomes in the United States because we've largely achieved herd immunity in the decades since the vaccine was introduced. We are seeing people forget and not having the memory that is associated with what our country and our world looked like before these vaccines were readily utilized. And so I know that parents want to have agency in determining their child's health, but just understand you're making a decision that you cannot unmake later when the measles outbreak starts. You really need to get your children vaccinated now, early, and follow your pediatrician's guidance on how to have that happen. But I just think it just reflects on our society that we have not seen these diseases as up close and personal as our parents and our grandparents' generations did, and we've forgotten what the consequences of having an under-vaccinated population really means.
I'll just add on that since mid-July, Maryland has seen 17 cases of measles. Every single one of those was an unvaccinated individual. And so in Maryland, and this is our concern in public health, and having a highly vaccinated population is what can help prevent that.
Thank you. I see that Tosin Fakil from DC News Now has the hand up. Go ahead.
Hi, good morning. Thank you. This message is for Mr. Elrich. On the issue of the backlog of maintenance, how, and I'm sorry if you said this earlier and I missed it, my service was going in and out. How is council or MCPS planning to address this backlog financially? Like, where's that money supposed to come from? And what's your message to parents as a new school year starts with this amount of backlog and things like possibly AC not working or moldy ceilings?
So MCPS doesn't have the ability to address the backlog in a meaningful way because they don't control resources. They're supplicants. They go to the state and they go to the county and they ask for money. The county has kind of locked the box around money at about $300 million a year. By the time you do transportation, you do whatever schools you're building or the schools that make it into the program, you do a library, you do, all the other things we do, $300 million doesn't go very far. And $300 million is where we were 20 years ago. So imagine trying to pay for what you paid for 20 years ago with the same amount of money today. It's not the same. I'll just, the council's been absolutely unrealistic about the viability of maintaining $300 million is what they're going to put into capital projects. If we had just kept with inflation for 20 years, we'd be up right around $550 million. These are real needs, and not funding them obviously doesn't make them go away. And I think that, hopefully this council, the new one, will come to terms with the things we're responsible for and what we need to do. Nobody should point their finger at the state because the state doesn't have the resources to fill this hole. They're going to be struggling to deal with basic services. Montgomery County has this opportunity where we've, differentiated ourselves from other counties in the area by our tax policy. When DC is taxing commercial property almost 80 cents higher than we do, and Virginia is taxing commercial property up to 42 cents higher than we do, and that money helps them pay for things. And it's not money that comes out of residents' pockets. There is a model out there that would put more money at our disposal and let us address these needs, not just school needs, but other needs as well. And we just have to face up to what we need to do. If we don't do this, if air conditioners fail, well, when they fail, which will be when you need them most, those schools will wind up being closed because you can't put kids in classrooms, with the temperatures, get as high as they get when the air conditioning doesn't work. So there are going to be consequences. The consequences are not going to be good. And we just need to get real, be honest about what we need, tell people honestly what we need. And I think, the public is pretty good about accepting things when they realize you need to do it. When you mouse around and you pretend you don't need stuff, and then all of a sudden you put yourselves in crisis mode, that makes people a little bit more irritated. I can't tell you how many people have come up to me and said, how did you wind up with the $3 billion hole? I said it was a lot of work over many years to create that hole. It's just time to stop and get real. I hope they do.
My second question, what's your message to your parents?
To the parents?
Yes.
While
their kids go to schools.
The parents should be talking to the council members and letting them know how important this is. Our school system is one of the things that we've been most proud of. Not being able to fully fund schools, whether it's maintenance or whether it's programming, are the kind of things that undermine people's confidence in the schools. And I think parents, should remind the people who are elected and have the power to make this decision that they would like to see us make the right decision and not jeopardize the schools and not jeopardize the kids.
Thank you.
Mm-hmm.
Yeah. Members of the media, any additional questions regarding back to school vaccinations? No more questions on that topic. Mr. Urgesa, you can remain. If you need to depart, please feel free to do so. Mr. County Executive, other topics?
Yes, thank you for joining us today. I really appreciate it. So our next topic for today is Overdose Awareness Day and Memorial is this weekend. And it's Saturday, the 29th. And this weekend, the spotlights is going to be on the lives we've lost to overdose deaths in Montgomery County. International Overdose Awareness Day is an opportunity for our community to come together, to honor those and remember those who were lost, but also to appreciate the work done every day to help our residents stay clean and sober. And on Saturday, the 29th at Memorial Plaza in Rockville, we're going to have Montgomery Goes Purple. We'll host a short memorial service at 9 a.m. and then the first color run, walk, or roll event will occur at 9:30 a.m. This event is meant for everyone in the community, show support for those working to demonstrate that prevention and recovery are for everyone. Resource fair connecting attendees with educators and community resources will be open from 9 to 11 a.m. In Montgomery County, we've had the foresight to go after certain drug makers for their role in marketing opioids to the public and medical providers. That this whole opioid thing was set off by a major American company that decided this was a great way to make money. Creating addicts was, just a delightful way to feed your coffers. They are being fined, but they're certainly not being punished. The money we've been awarded in court is helping to pay for treatments that would otherwise fall on taxpayers, and it's sick to think that the drug makers who made ungodly amounts of money on the death and destruction only have to pay fines for what they've done. That's the world we live in. Drug makers and distributors over opioid lawsuits are expected to bring Montgomery County approximately $34 million over the next 18 years. Not nearly enough to run the treatment programs we need to run. The same suits are expected to net the state of Maryland about $400 million over the same period. These are crucially needed funds to help our community recover and heal from the deadly impacts of drugs like opioids. We're seeing fewer overdoses since 2024, but our work is far from complete. Every life lost is one too many. Those deaths tear apart families and change lives for generations. And I encourage everyone to support the overdose awareness efforts and to help prevent more tragedies in Montgomery County. Finally, earlier this summer, the County Council appointed Dr. James Hedrick to the Planning Board. Again, I should say reappointed. I was disappointed with this decision because during his time on the Planning Board, he's shown pretty much disregard for serious policy and legal issues raised by residents. That's why I'm sending a letter to the council disapproving of his reappointment. Planning Board is part of a separate state agency, the Maryland National Park and Planning Commission. In no other county in the state of Maryland is the Planning Commission part of a separate state agency. They're all part of the county government, everywhere but here in Prince George's County. Although it's not part of the county government, the county council oversees the planning board and appoints its members. But all planning board members were replaced in 2022, which I thought was totally unjustified. They had a couple of planning board members who had done things wrong. And rather than place the blame on the people who had done something wrong, they pretended that this was a problem of the entire planning board and they replaced the entire planning board. That was not necessary, but they did it. That has not, I guess I had hoped there was an opportunity to appoint members who actually took seriously community planning processes and thought the residents ought to be meaningfully involved. It hasn't happened. Instead of providing a framework committed to sound land use and planning principles, the current board has opted for a process which fails to produce a respectful balance between residents' concerns and developer wish lists. Dr. Hedrick was first appointed in 2023 over my veto then. During his tenure, residents affected by sector plans and major land use proposals have repeatedly raised serious concerns about development intensity, infrastructure capacity, school enrollment, transportation, environmental impacts, neighborhood compatibility, and whether commitments made during the planning process would be honored. We need planning board members who help build a county that works for everyone, not just land use lawyers and developers. Planning board decisions touch every resident's life: master plan, zoning, subdivision approvals, park policies, and capital facilities. These are all decisions that shape what our neighborhoods look like and who can afford to live in them. Since his appointment to the board in 2023, Mr. Hedrick has reviewed and approved many plans and projects without demonstrating any willingness to engage constructively with residents and address their underlying concerns. To cite just a few examples, during the Tacoma Park Minor Master Plan Amendment process, residents raised concerns about upzoning multifamily properties that house long-term tenants, particularly low-income tenants. They pointed out surveys indicating that tenants' support for improving the properties were misleading. The people who knocked on tenants' doors asked them what they liked about their community and what improvements they wanted to see. They were never asked if they supported upzoning that would incentivize property owners to tear down and rebuild, potentially displacing them. Mr. Hedrick and other members of the planning board relied on unrelated survey results without further engaging those tenants. And I'll tell you, I'm seeing the same thing in the East Silver Spring plan. I've talked to tenants who told me they were told that, you support this plan and you're going to get new apartment buildings. They're not going to get new apartment buildings. They're not going to be able to afford to move back into the new apartment buildings. But they conflate tenants wanting better living conditions with tenants wanting to be displaced by new housing. In the University Corridor Plan, he was uninterested in the comments from thousands of residents who pointed out problems with the corridor plan that ignored adjacent communities and disregarded the realities on the ground. Substantial critiques and comments from residents were never addressed, beginning with the questionable, incoherent boundary lines of the plan that bisected multiple communities and was based on a bus rapid transit line that doesn't exist and isn't even in the planning stage. In addition to being a direct conflict with the just enacted ZTA 2502 workforce housing development standards, the plan-wide rezoning promoted the reduction of tree coverage and increased imperviousness, contrary to climate change goals. Perhaps worst of all, the plan incentivized the replacement of naturally occurring affordable housing and the displacement of existing residents from their home. Mr. Hedrick's lack of discussion and response to these concerns shows a complete misunderstanding of how to address the issue he claims to be a champion of, which is housing affordability. He did not question a plan based on the faulty assumption that upzoning solves the affordability problem, nor did he acknowledge the reality that although the county has created zoning capacity for current and future housing needs, more than enough housing than is projected to be needed by 2050, and that projection is actually going down, we haven't managed to make it affordable. In the Planning Board's July review of a proposed development called Friendship Commons, local community representatives and hundreds of residents wrote. Many testified to object to the virtual clear-cutting of mature specimen trees on the former Geico tract. Many others, including the Village of Friendship Heights with over 5,000 residents and the Brookdale Civic Association, raised serious legal questions about the legality of certain planning staff recommendations. Mr. Hedrick did not respond to any of the public concerns or follow up with staff to understand and address the issues. Residents do not expect the planning board to adopt every position they advance. However, they do expect to be treated with respect and to have their concerns meaningfully considered, fairly evaluated, discussed, and reflected in the board's deliberations. In his first term, Mr. Hedrick had failed to understand the importance of acknowledging and addressing residents' legitimate concerns about the consequences of the board's decision. To the contrary, he's been dismissive of their concerns. His record reflects an approach too readily prioritizing his own zealous support of increased development capacity everywhere, I emphasize, and housing production without thoughtful consideration of other equally important statutory and policy goals, including public infrastructure services, environmental protections, racial equity impacts, and the community safeguards needed to support that growth. Sadly, this is true for the planning board in general. While Mr. Hedrick has not listened to the residents' concerns, the majority of the planning has also chosen to disregard those concerns. It continues a pattern of a move away from community-based planning, which we used to have in Montgomery County, where residents were encouraged to actively engage in planning their future communities. I urge the County Council to reconsider this appointment and select someone who will propose a balanced, sustainable, and responsive housing and growth policy for the entire county. The residents deserve to be part of planning for the future of their communities. Before we open the floor for questions, I'd like to give my staff an opportunity to share any updates they have, and I'll start with my health team.
Thank you, Mr. County Executive. No additional updates at this time from Public Health.
Yeah, I just wanted to highlight on Monday at Sherwood High School, we had a staff member that went into MCPS had a staff member that went into cardiac arrest during dismissal, and I just want to. I was part of the group this morning with the superintendent that congratulated and thanked the school staff members who stepped in, provided CPR, and deployed an AED until fire rescue staff arrived. They were able to bring that staff member out of cardiac arrest. Obviously, this is a pretty traumatic thing during transition day for the first day of school for the freshmen coming into Sherwood High School. Fortunately, they weren't in the room when this happened, but obviously just wanted to thank both the first responders who heroically responded and were able to save this man's life, but also, frankly, for the MCPS staff who jumped in and helped their fellow coworker, and obviously saved his life. And he'll hopefully the individual who suffered the heart attack is believed to make a full recovery. So just wanted to recognize the people who acted so heroically on the first day of school.
Thank you very much for sharing that. Okay, members of the media, any questions for the county executive? I see Shirley Hackleby, Bethesda Today. Go ahead. Good afternoon.
Good afternoon. Back to the appointment of Commissioner Hedricks. I just was curious, Mr. County Executive, you mentioned that you see the lack of listening to resident feedback as a problem that applies really to the whole planning board. Have you ever vetoed the reappointment of any other member of the board? And if so, why not?
I haven't had the opportunity to. This is the first round of people coming in front of me, so I didn't. Not everybody's as upfront dismissive as he is. I'll just put it that way. There are a couple on there who are extraordinarily dismissive. And I vetoed his appointment when he came over to me the first time. But nobody should be surprised when I'm vetoing again, because he's exactly what I thought he would be.
Do you anticipate that the council will be receptive to your veto, or do you expect
No,
that
I
it will
think
be overridden
that
again?
they're perfect. They've demonstrated, at least this council has, that they made decisions with minimal public input. Have not taken up the issue about whether we should revisit our planning process, which used to involve lots of citizen input and now has virtually no real citizen input. Your input consists of being invited to a charade. They call it a charrette. And then you get to put Post-it notes on a board. And then they will report how many Post-it notes they collected and how many residents put them on the board. And then they do what they were going to do anyway. They walk into these decisions, and this didn't used to be this way. They walk into planning, deciding what they already want to do and telling people what they want to do. I know this because I served when I was appointed by Duncan. And if you're too young to know the history, but Duncan and I weren't political allies, and I represented a different point of view than he did. I was appointed to a major transportation committee, and I was appointed to the Silver Spring Sector Plan Committee, and I was appointed to the committee that was looking at how to come up with a development proposal for downtown Silver Spring. These were real committees with real residents who sat around tables and talked. And the planning staff back then, they were staff. They would come into the meetings. We would, there were always problems. And when I was on the Silver Spring sector plan, the issue was development hadn't occurred in Silver Spring where we had hoped that it had occurred. Tall buildings were built not in the center near the metro. They were built a little bit farther away. And what could we do, to change that? And there were a host of other issues. Some people wanted to rezone all of the small business areas. So the kind of compromises that worked out is they came up with a plan to densify the core closest to metro, but the residents insisted on preserving the small businesses going down Fenton Street on that area over there. They wanted those businesses to remain because they serve a function in the community. There was a big push to get rid of all the auto shops in Silver Spring. Of course, all those auto shops serve all the residents of Silver Spring and Wheaton and other surrounding areas. And had they been displaced, people would, already have a hard enough time finding auto repair. There was an example of people talking about things. How do you solve the problem? How far do you go? And what should we do? Park and Planning's gotten rid of all that. It no longer functions that way. It is, this is what we want. This is what we're going to do. You're a bunch of NIMBYs, not good people. Planning chair has said, the planning board, the planning director has said some pretty, I'd say, inappropriate comments about people who live in single family houses. And it's just not what it used to be. And it really is dismissive of residents. And, the reason you don't see a lot of jumping up and down is because master plans are only done every 15 or 20 years. So once your master plan was done, if your master plan was done 20 years ago, you don't see what's happening now in another community because you're not coming under that plan. If this was something that you experienced every 5 years, I'm pretty sure people would be pretty upset. The folks in Four Corners and along University Boulevard are furious with the idea of going into a neighborhood, knocking out streets that had dead ends so they could make all these streets through streets, which is just an invitation to more traffic, densifying the interior of neighborhoods. I mean, when people buy a home, you're usually looking for a neighborhood where you want to live. You like the streets, you like the trees, you like, a lot of things about it. And to have planners who don't live there just walk in and say, you shouldn't live in this type of community and we're going to rezone it, is just, doesn't go over very well. And for me, it goes over even worse because having been part of approving all kinds of master plans, the county is zoned for more growth than we're projected to have by 2050. And the sudden obsession with going into existing neighborhoods, which, by the way, are not close to jobs. Most of the jobs in the county, Park and Planning has a graphic that shows this, and we did a study internally that showed the same thing. Most of the jobs and housing planned in the county for future growth are in the I-270-355 corridor. So why you would look at neighborhoods that aren't anywhere close to those corridors where the jobs are going to go is beyond me. So there are a lot of things that I think are wrong. I don't have time right now to spend the hour or two it would take me to do this, but this is not the planning department or process that we used to have. It's not the one that won the respect of communities, and it's one that is constantly putting us at odds with neighborhoods.
Thank you.
Thank you. Members of the media, any additional questions for the county executive and government officials this afternoon? No more questions? Well, thank you everybody for joining us. Have a great afternoon. Stay safe, and we'll see you next time.